Good evening, everybody, and welcome to the Business Power Hour with Darren and the Music Man on this rainy, horrible Tuesday, all day into tomorrow. Rain.
Heavy rains, heavy winds, all that other fun stuff.
Yeah. How was your day?
Like I was telling you before, busy. Just in the office, cranking out stuff. Got a lot of stuff going on. So
did you finish with those extensions or whatever it was you had? Really had to do, you and all the other accountants?
Oh, that stuff, yeah. All my returns have been filed and all that. Like I said, I don't focus on that and all that stuff. But you remember me telling you last night, when we were on last night, for those of you who missed the shows, like somebody we know, Eileen,
that watches usually
every week, but
and her friend was
didn't
on.
know we were on, and a friend was on. But we won't tell her that. I told you I have an addition to the family. You got a new addition to your family earlier in the year, which was getting huge. I got a new addition to my family, and I didn't have a picture, but now I have a picture. So this is the new addition to my family.
That's a monster. Can everybody see that?
So that's
Wow. Tell everybody what's in it.
That's a Harley Electra Glide Ultra Limited. It's actually a fireman's edition, so it's got every bell and whistle under the sun.
You should have got
It's got
pilot's edition.
It's got heated hand grips and
heated hand grips.
Oh
my God!
Like that. So I'm pretty excited to have it, and we spent the day Saturday.
When did you get it?
We got it Friday after. I got it Friday afternoon.
This past Friday?
Yeah, this past Friday. So. Yeah, I saw it and bought it and said, that's it. I want it. And it's a used bike, but
it's used?
It's used.
Well, it looks brand new.
Yeah, it was very well taken care of. It's a 2011, believe it or not.
Oh, really?
And
you know what? By you talking all about this piece of beautiful machinery, I know that our guest is saying she's looking at her watch and she's going, why haven't they got to us?
Yes, that's it. I don't want to waste her time.
Well, she's going to have, we're in control. She's normally in control, but we're in control.
Yeah, but Norm, you're going to get help if we don't let her.
We get help from her anyway. She could take us every week, so that's it. Actually, let's get started with this. We have the honor of having two people on our show tonight from different parts of the United States. They both their organizations that they're involved with have to do with advocacy, medical advocacy, patient advocacy for everyone. They are the king and queen of patient advocacy. And let's welcome them to our show right now, Ilene Corina and Schwartz. Hello.
All right, welcome.
So now, is that not worth it? You are the queen, and that is the king. We bow down to you. We pay homage. The floor is yours.
Well, first, before we got chatting already. I don't know if you guys can see it on that side. Eileen, can you see the chats that are coming up? Mark Berlin's on. Hey, Mark, how you doing?
Hi, Mark.
My cousin Gina's on. Hi, Gina.
Maria Rodriguez.
Yes. Hi,
hello.
Maria. How you doing this evening? So,
Joe, look at that. President Biden.
President Biden? What are you talking about?
No, President Biden's on. He's waving hello to the two of them.
You know what?
Let's
not take our time up.
That's it. let's not take her time up anymore. So, Eileen, tell me. All right. Well, let's start with Brad. Okay, because Brad is a unique individual. He's in advocacy.
Yeah, it's hard to say. I had to say
advocacy. Right. So, as anybody knows from the show, Eileen's been a friend of this show, and she's been on the show a number of different times.
Pulse
is her organization. It's really about patient advocacy, and she does a great job with it. Brad does an unbelievable job himself, and he's based in Chicago, right? And it's not a matter of different organizations competing with each other. You guys actually work together and help each other, right? Very closely. So, Brad, tell us about your organization, what you guys are all about, and how you got started.
My organization is called Greater National Advocates, and it got started because in 2004, I had a horrific medical scenario occur to me. I ended up going into the hospital with a headache, and I left 6 months later with no limbs. And that's the short version, and that's what happened. Suffice it to say that there was plenty of medical error to go around. And as a result of what happened to me, combined with the fact that I was a lawyer before it happened, taking those skills, trying to figure out how the hell I can make sure that something like that didn't happen to anybody else, I started promoting this concept based on a lot of work that a lot of other people did before I became aware of it, Eileen being one of them. But, you know,
explain what that happens to be.
What does it mean to be a patient advocate?
Well, patient advocate is, you know, when you're a patient, it's really hard to be able to even speak for yourself. And, you know, in my case, it was true. I was way more knowledgeable than your average person, and I wasn't afraid to go to the hospital. And obviously I have a mouth, and I wasn't afraid to use that either. But, you know, you freeze when it's you. There's an old saying that a lawyer that represents himself has a fool for a client. I apply that to patient advocacy as well. So many people go into emergency rooms and go to doctor visits like we all do, and we just sit there, we nod our head, but we don't ask the questions because we're in a foreign environment. We trust people, you know, as we should, but at the same time, we need an advocate, we need a voice, and we need somebody there with us. And I think that there's a movement that is headed in that direction. And that's why Eileen and I work so well together, because we understand that when we all partner together and we wake up the nation and wake up the people and the patients, while at the same time, you know, bringing in the healthcare providers and letting them know that we exist, and training and collaborating with each other, we're building like an army of patient advocates out there that are making themselves available to the public. So when you ask me, what does GNA do? I make those people available to the public. So
basically GNA is training people to be patient advocates.
No, I don't do any training. That's why I partner with Eileen. Eileen is one of the most fantastic, adept, skilled trainers in the world. And I trust her and other people like her to do a lot of the training.
So let me interrupt you just 1 second, if I may. Eileen, don't carry this conversation. To answer the question, then we're going to get back to you. What does a patient advocate do? What's their responsibility?
They advocate for the patient in many different areas. It could be billing, it could be at the bedside, it could be information sharing, it could be a lot of different ways. And even lobbyists now are calling themselves patient advocates if they're working to change the laws. So there's a lot of different areas, and that's one of the things that Brad is helping people understand, is that you can go to his website, go to his organization, and choose what your needs are. It doesn't my needs of somebody to sit at the bedside may not be somebody's needs of sitting in church.
Your question. Does a patient advocate actually talk to the nurses and the doctors to get information to say yay or nay and explain it to the patient?
If that's what they've chosen to do, is their profession and what their relationship with the patient has decided to do. So the short answer is yes, in those occasions. And what I do is, yes, I talk.
Okay, you stop there. We're going back to Brad. We'll be back to you.
Okay, wait. I got a question before we go any further with that. So I had an experience with a friend of mine a few years ago where I walked into the room and he was loopy, meaning he really didn't know what was going on. And you know who I'm talking about, this gentleman sitting next to me.
Getting a phone call.
Right?
Is that a phone call?
No, that's not a phone call.
Okay.
All right. And he I was standing there, and the doctor came in and started talking to him. And I knew he really didn't understand what was going on. Is that why it's so important to have a patient advocate in the room? And now my question to you, Brad, is I mean, a lot of times we go into the hospital, we don't even realize we have to go to the hospital. So we're not prepared. How do we prepare to make sure we have the right people surrounding us to help us? Because immediately everybody goes, well, my family's there. But I can tell you this, my family wouldn't know if a doctor came up and told them he needs this, this, and this. They would just go, okay, because they don't know, right? And my understanding is a patient advocate would know what to ask, what not to ask.
Sometimes depends what it is. You know, it
Right.
depends if the person the advocate has a medical background. Or
Well,
not a
that's
medical
why I'm
background.
asking Brad. How do I prepare for the need for having a patient advocate?
Well, I mean, nobody prepares to go to the emergency room. Nobody, marks it on their calendar. This is what I'm going to do this afternoon. And I think that my job and my role in the entire advocacy realm and field is to let the public know how important it is and spread the word about the good work that all these advocates out there are doing. So it's a huge part of my mission. I mean, right now, it's hand-to-hand combat out there trying to instruct people and let them know, and the people that are on this call hopefully are learning something about it, and I know about it and you guys do, but it's a public awareness mission, and that's why we're here, because we need to spread the word about the profession and what people are capable of doing. And Eileen said it, some people just get hit with a $50,000 hospital bill that they thought was going to get paid because everybody told them it was covered. And then 2 months later, they're in collections. There are advocates that specialize only in that sort of thing. And they used to work for the insurance companies and the hospitals that are doing the collection. The same thing with the advocates that would go into, let's say, on the clinical side in a hospital setting. If I needed it, I would want somebody that had experience in the ER, felt comfortable, knowing how the system works, who's in charge, and who to talk to, and maybe know when the last shift change was and who transferred information to the next people, because that's when mistakes happen. So we're trying to, fill in the gaps in medical care with the understanding and realization that human beings make mistakes. And despite all of the technology and all of the tools that we have, I don't think there's any better substitute to prevent an error from happening than to have somebody there with you by your side and to know about patient advocacy.
Okay, if I can, I'm sorry.
No, go ahead.
Darren mentioned something about knowing somebody that was loopy. And yeah, that was me. I was in the hospital for 3 months. And Darren happened to walk in many times, a couple of times each week, to say hi and see how I'm doing. I was completely drugged out, but I was protected because my wife is an RN of 45 years. She's director of wellness. At 6 o'clock in the morning, when shift change was happening, she would be speaking to the doctor. During the course of the day, she'd be calling the doctor. In the evening, she'd be calling the doctor or the nurses, whatever. I'm one of the fortunate ones that have that. What you guys do is make up for the fact that I had it and other people don't, and
Correct.
You help them.
So Brad, you said before, people make mistakes. Everybody makes mistakes. We know that, right?
Right.
From a medical perspective, what are the statistics? And Eileen, you may know this. You may have this off the top of your head. Typically, what is the statistics of medical errors that occur, on a day-to-day basis?
Well, make it simple, and let's just say that medical error is the third leading cause of death in the United States. And you could break it down by minute, by day, by month, by week, whatever you want. That's the bottom line. It's the third leading cause of death in the United States, and it's been that way for at least 15 years.
And that's a shame, right? So it's a reality, and we have to prepare for it. I want to give a quick shout out to the Golds. They're watching tonight. And Darren's in it. Yes, Darren. Darren would call me if he ever ran into a problem. He'd just say, call Darren, and he'll figure it out.
Gina Giraldi.
Gina's been on all
Sandra
shows.
Gold.
That's one of my cousins. So
He has so many cousins. You have no
it's
clue.
crazy. Anyway, so one of the things that I have learned in my association with Eileen is that there's certain things you should be carrying with you at all times in case, the accident happens and you have to go to the hospital. And one of them being, he's going to take his out right now because that's what he does every time I bring it up.
Because it's important.
It's important, right?
Yeah, stuff for.
Okay, is basically a health proxy or a proxy saying, hey, if something should happen to me, this is the person that has the right to speak for me. Now, is a patient advocate somebody that you would add to that or no?
I don't think so. I mean, it's going to really boil down to the relationship because, a patient advocate doesn't always need to be a hired patient advocate or a third party patient advocate. A patient advocate could be a friend or a family member if they understand and they're willing and they know what to do. But the most important thing about these advanced directives is making sure that the person who is in charge of those advanced directives knows it. Because a piece of paper is all fine and good, and we're talking about a scrambled, jumbled healthcare system where we're trying to prevent medical errors from occurring, and a lot of the times those advanced directives, they're going to be the last thing on anybody's mind unless you present them to the proper person. So it's extremely critical to have them in place, but don't think anybody is going to know where to find them unless you take it upon yourself as a patient, take charge of your own health.
Interesting phrase, take charge.
Take charge.
We will get to that. Here's what I've done. Hearing Eileen constantly talk about having this healthcare proxy. It's a big piece of paper. You can shrink it. So I did one better. I shrunk it down to this. I don't know if everyone can see it. I have my wife's, I have mine. It's in plastic. I went to Staples. I reduced it. I covered it. I'm covered now. My wife's covered, and God forbid there's any problem.
Here's the thing, and you said, Brad, you got to take charge. Sometimes you're incapacitated, right? And you know what? I say, God forbid, I got into a car accident and I'm unconscious, right? Now, Eileen, we asked Brad this question. I want your perspective on this. If I have the health proxy in my wallet, what assurance is that anybody's going to see it? Number one. Number two is, well, who should we tell that we even have it? Who should know that we even have it? So if something comes up, I'm talking about family members or who kids, parents. Should we tell everybody that, hey, I have a health proxy and this is what it's about if something should happen to me?
Well, it could never hurt to do that. But the idea is that the person who is the healthcare proxy also needs that copy. Because if they're the one who's walking into the hospital or calling, they want to be able to show that they're the person whose name is on there. You brought up before the difference or the similarities. In our training, we do talk about the differences in the healthcare proxy or surrogate decision maker. Different places in the country, different states have different names for that. A healthcare proxy is a person who can talk for the patient when the patient cannot speak for themselves and make decisions. An advocate is a person who speaks with the patient when the patient can speak for themselves. So it's not automatic that they do the same thing. They can be the same person, but they're very different in title. So an advocate cannot be making decisions for a patient, especially a board certified patient advocate, which I am now, and they have this board certification now. It's very different than being somebody who's a helper or a family member. So a family member can, all bets off. They do what the family wants them to do. But a professional patient advocate cannot be making decisions for the patient, and they shouldn't be. Where a healthcare proxy is the person who will make the decisions.
Why are you a healthcare proxy? What made you decide to be a healthcare proxy?
She just said she's an advocate.
Well, I'm an advocate. I'm sorry.
I am to some people. And ironically, what's interesting is when I'm a bedside advocate, one of the things I do is I visit people in the hospital, go with them to the doctor. That's what I do. And I have been there when the nurse comes to the patient before surgery, hands them a paper and pencil, a pen, and says, sign here, who's your healthcare proxy? Well, a healthcare proxy or surrogate decision maker needs to know what the wishes are of the patient. Would they be accepting of a blood transfusion or experimental treatment? If they can't speak for themselves, it's more than just being a name on there. It's the conversation that goes with the decisions that a healthcare proxy or surrogate decision maker will make for someone. So if I was your healthcare proxy, Darren, I can't be your healthcare proxy because if right now you can't speak for yourself and you're unconscious, I know nothing about your medical condition or your wishes to make decisions for you. So I can't accept that responsibility. As your advocate, sure, I could make sure that we understand together what you want done with the treatment, that you understand the doctor and nurses and the care you're getting. But you're conscious and we can make those decisions and have that conversation together.
So that's a great way to put it, Eileen, and you kind of spelled it out as to the differences between the two. But everybody should, in my opinion, everybody should have a healthcare proxy. And they should know that they're your healthcare proxy. And they should know what you want them to do. Right?
Right. And they have to know because they have to sign it.
Right.
And it is a legal document, but you don't need an attorney. A lot of people go to their attorney to get this. You don't need that. You can print it off our website. The Department of Health websites in almost every state have this. You probably need 2 witnesses and having the conversation. Some are 3 or 4 pages because they want you to list your wishes and what you want. There's some religions that don't allow blood transfusion or organ donation or certain things they don't want. So those are the conversations that you have. And keep in mind, I always bring this up now, that if you have an 18-year-old child going away to college, 18 years old is an adult. They need a healthcare proxy because if something happens to them when they're in college, my son had a car accident. I could not get information. He was halfway across the country. I could not get information. Now he carries it in his wallet that I'm his healthcare proxy.
Okay. So now, Brad, you said 2004 you had your situation where you went into the hospital and you came out and unfortunately it didn't turn out too well. When did you decide, was it at that point you decided, hey, I need to do this, I need to get people educated?
No, in fact, I went back to work and I thought I was going to be able to change things by helping other people that had already gone through medical error. And I became a medical malpractice attorney. And the evolution into how I started doing advocacy was based on answering all the phones from everybody that was calling, thinking that they had a medical malpractice case when really they needed an advocate. But they didn't know who else to call, which is kind of how I found my lane because of the people like Eileen and other organizations that we've been talking about. I thought that the one thing that maybe was missing was, promoting this idea to the general public. I didn't know about it. If I knew about it, hopefully, I probably would have had a different outcome.
So before all of this happened to you, were you an attorney before that?
I was. Yeah, but I was on the other side. I was representing insurance companies.
Okay.
So, karma, right?
Karma, right? Yeah. So it's unfortunate that, and here's the thing, and everybody that we encounter that has a passion and works in organizations like yours, some life event happened that kind of pushed them into that lane, and you grab the ball, and you take it to that next level, and that's what you guys have done. You've taken advocacy to the next level because, Eileen, to be honest with you, I never heard of it until I met you.
Neither one of us.
No, I didn't know what a patient advocate was. I knew health proxy, but I thought they were one and the same. And tonight's definitions, you made it very clear. They're not. They're just knowledgeable people that are going to help you make decisions. Now, is an advocate, say, let's go back to my scenario again. I get into a car accident, I'm unconscious. Can an advocate help that health proxy make good decisions? Because a lot of times, too, our health proxies are somebody who's very close to us. And if we're in a critical state, their mindset may not be right. And they may just say, do whatever you got to do to keep them alive.
You save them.
Save them. And maybe, by not asking the right questions, it could turn out to be a tragic thing. So
Darren, when I'm an advocate at the bedside, one of the things I always ask is for a copy of the healthcare proxy and the phone number, because as an advocate, I might be on the phone with the person who's the healthcare proxy at any time. So I can't be making the decisions, but I could be relaying information for the healthcare proxy. So I usually have in my book of information the names of the people that the patient wants me to call, or people, their faith leader, their their religious, spiritual leader, their boss or people from work, and their healthcare proxy is always something as an advocate I have access to, because I can't make those decisions. You never know when that might happen.
Brad, as an attorney that's a medical attorney, as you are, did you take a lot of medical courses? I have a couple of friends that do the same thing in New York, and they've done everything but got a license to be a doctor.
For me, it's so much. It was 15 years of on-the-job training. I equate it almost to being a resident, because you get thrown into court. You have to read medical records. You need to learn how to understand them. Next thing you know, you're cross-examining and deposing doctors. And I was working at a firm where, some of the big firms that would never, ever happen. You would end up being, maybe mentored, tutored, being carried around by a partner for 5 years before you touched anything on your own. But I guess I lucked out. I got thrown to the wolves, and it was, feast or famine. What am I looking for?
Right.
Some people get it, and when you do, I don't know. It's not hard to. I mean, medicine's difficult, but people are the same. And
okay, so Brad, somebody wanted to get more information about your organization, right? How could they do that?
Well, there you go. I was just going to ask you, based on these scenarios, if you needed help, where would you go? We've been talking about patient advocacy and how important it is, and how we'd all like to have one. But like I said, my organization is, I think it's the premier place to find one. It's gnanow.org. And these are all the places that you can get a hold of me, short of giving you my cell phone number, which I can do. I do answer it. But I'm reachable, and I'm accessible. And I'd love to talk to anybody that wants to.
You wish to give out your cell phone number?
No, I'll give out my business line that goes directly to my cell phone
There
number.
you go. Give that out, Bradley.
312-345-0400. Again, 312-345-0400.
You've done this before, Brad. I can say that was well done.
And Eileen, if somebody wanted to get a hold of you, how could they do that?
PulseCenterForPatientSafety.org, and my email is Karina at PulseCenterForPatientSafety.org. And they can call 516-579-4711. Darren, I just want to make one comment about something that you said before. When you walked in that room and Norman was, what was the word you used? That he was loopy.
I'm still loopy, by the way.
You became his advocate. If you were helping him at that moment, you have become his advocate. There's no formal training that's needed to be able to support someone and help them through the healthcare system, as long as you're willing to help ask the questions, help take notes, and help them through. There's so many different levels, but we start with that moment that you walked in and helped him.
Okay, I'm sure we're going to take a break now.
So I was your advocate.
For that moment, yeah. We're going to give out a phone number, and then we're going to give it out again.
Actually, we're not going to give out the phone number.
We're not going to give out the phone number.
We're going to take a short break, and when we come back, we're going to open the phones up.
And we'll open the phone
and we're
lines.
going to learn a little bit more about what Eileen does and how she trains
And
these
pulse advocacy.
All right, we'll be right back right after these messages.
Well, get out of that bed, wash your face and hands. Get out of that bed, wash your face and hands. Well, you get in that kitchen next to North with the pots and pans. The way you wear those dresses, the sun comes shining through. The way you wear those dresses, the sun comes shining through. I can't believe my eyes.
Coming on the Business Power Hour gives you something that you don't normally get with your typical advertising on the internet.
Or in the newspaper.
Right?
None of that stuff.
You get thousands of viewers who see the show every week, not only locally, but nationally and internationally.
For a very nominal fee. Actually, we did it and we broke it down. It will actually cost you 0.75 cents per view that you get. That's it. All right, so if you're interested in being a guest on the Business Power Hour with Darren and the Music Man, please give me a call at 631-698-9696 or email me at norman@friendentusa.com or call Darren at...
You can call me at 844-987-CBMS. That was 844-987-CBMS, or email me at Darren@bphdmm.com.
I think I'm going to get in touch with you also.
Yeah?
I am, to make sure that you get here on time.
Oh, okay. Yeah.
All right?
It's the first time ever I've been late. Pachera aquata, also known as the money tree, is a tree that flourishes in the tropical rainforest. Unlike other trees, it depends on 5 separate trunks to prosper, each one bringing its own share of water and nutrients to the leaves. Like the money tree, your business has many different trunks that need your attention. Sales, marketing, finance, operations, and culture. Fail to cultivate any one of these and the whole tree collapses. I understand this better than anyone else, which is why I developed My Prosperity Tree, a program designed to address all of these areas, not just one or two. We help you identify who you are as a company, define your direction, and assist with developing the systems that will enable you to scale your business the most efficient and effective way, allowing your company to bloom into your own prosperity tree. So plant your tree today by visiting myprosperitytree.com or call us at 844-987-CBMS. That's 844-987-2267.
And welcome back to the Business Power Hour. And yes, Eileen, we were talking about you behind the scenes, so there's your answer. We have some more people, Joe Ponte and...
Actually, Gina had to leave, my cousin Gina.
All right, our phone number.
Gina.
If you want to call in, if you want to ask Brad or what's your
Eileen.
A question, it's 631-619-7500. 631-619-7500.
I'm going to move that up there so the number's not going through him, it's going through us. So before the break, we were talking about, each organization, really about Brad's organization and what he does and how they do it. But, wow, look at this. We got a phone call. Already. All right.
Good evening and welcome to the Business Power Hour. May I ask who's calling? Hello? Hello, can't hear you.
Good evening. How are you?
Hi, how are you? Who are we speaking with?
I'm sorry.
Who are we speaking with?
It's Adria Gross.
Adria Gross.
How are you, Adria? How you doing tonight?
I'm doing great. How are you?
Good, thank you. And you have a question for our guest?
I wonder if Eileen or Brad ever remember who I am.
This was the person I was telling you about.
Ah.
I didn't catch
Adria Gross.
Think advocacy, special kind, your field.
Actually, Brad, you actually named this
You
particular
did.
advocacy before we were talking.
I named what?
What this young lady does, what this person does that knows the two of you pretty well.
Well, obviously,
Well, sort of well.
because they don't remember the name. But Adria Gross is a advocacy.
Well, let's let Adria say who she
Adria,
is.
tell us who you are and what you do.
All right, I've had multiple conversations with Brad, and I met Eileen about 5 or 6 years ago in Albany.
Adria, can you hear me?
Adria, can you hear Brad?
Adria,
Yeah, I can.
Yeah, I remember. I know your voice now, and I remember. We have had a few conversations. How are you? What's
So-
going on?
So, Adrian, tell us the type of advocacy that you do. We were talking before. Brad actually brought up the type that you do, but tell me, I'm somebody who comes home from the hospital, and you're a billing advocate, correct? Whereas
Correct.
all of a sudden I get this crazy bill out of nowhere. So, tell me what a billing advocate does.
So what I do is I help people have problems with medical bills when they're denied, out of network, overcharged, they can't get pre-authorization. I also help people who've had denials for long-term care policies when it should be covered. And I help people when they have a Medicare Advantage plan. They've been in a nursing facility and they're informed that we're not going to cover you any longer. Then the only way to get covered is they go direct over to Medicare.
Okay, and if I'm not mistaken, you used to work for insurance companies, like I said earlier. I mean, this is pretty much the exact scenario that I was talking about, right?
We got a bad connection going on here.
Adrian, Brad said that before you were doing this, did you work for an insurance company?
Yeah, so I had a crazy story. I'm sorry, I'm hearing double. I started out after I had brain surgery. I've been living with epilepsy for almost 25 years of my life due to an insect bite that put me in a coma and averaging 18 seizures a month. My first job was working at Blue Cross Blue Shield, where within 2 weeks they taught me how to deny claims. And then I worked there for 2 years, went to AIG, and then they taught me there also within 2 weeks how to deny. So I wound up working 12 years in the health insurance industry in claims and underwriting.
Yep.
Then I opened up a medical billing business, and now I'm a national advocate. I also wrote a book called Solve Curing Your Medical Insurance Problems, which Ralph Mayer likes so much he won the international edition. Multi-payer medicine nightmare.
Adrian, I don't want to interrupt you, but you're going to be a guest on this show in a few weeks. And I want to get back to Eileen and Brad, if I may, to give them the rest of the evening. But I'm so glad that you called and said hello. I think Eileen's still in shock. I don't know what's going on with Eileen, but
That's okay. But Adrian, we want to thank you for calling in, and we're looking forward to having you on the show in the next few weeks.
first week in December.
Thank you.
Thank you. Thank you, Adrian.
Have a good night.
Have a great night.
You too.
Bye-bye.
Bye-bye.
All right, so she's an author, but I also know another author that we have right in front of us who actually wrote a really cool book called Rants of Patient Safety Advocate, Stories from the Bedside, and that's Miss Ilene Corina. So Eileen, there you go. How did the book come about?
Well, I've been blogging for over 10 years about my experiences, and then decided, what am I going to do with all that information? People were writing books about their expertise, and the book is based on, there's about, I don't remember how many stories in it, but it also has a story about the other side of the opioid crisis. Somebody who needs opioids just to avoid pain, to stay off pain. So it's stories from the bedside and real experiences and lessons. I try to always keep a lesson in all the work that we do. Even when things go wrong, we need to pull a lesson out of what happens so others could learn, so it becomes something that we can improve upon. So the book is important to me because it is some of the experiences, but also on my personal website, which is ikarina.com, is the blog and all the years of experiences. And some people will recognize themselves in there because they're all true stories. And
If somebody wanted to get the book, how could they get it?
it's on Amazon, amazon.com. It's Rants of a Patient Safety Advocate. It's only $10, and it goes to support, the money goes to support Pulse, the organization.
Excellent.
Eileen, how do you finance this organization? What is it? Can people help you and Brad? Do you accept donations? Do you get grants? Tell us how we can help.
We absolutely accept donations. That's strictly donations. We have to get small grants. We've got small grants right now. Our grant is to work on the Take Charge campaign. We based
What is that? What is the Take Charge campaign?
the Take Charge campaign. So glad you asked. Take Charge is 5 steps for safer healthcare. We're in the 2nd year. It is, and Brad, of course, is involved with this also. We're actually working on a conference for March, a virtual conference. We've gotten so big over COVID, not just helping people who are sick and hospitalized and preparing to become patients because people are not necessarily prepared, but the Take Charge campaign has 5 steps for safer healthcare. The website is takecharge.care. I'm happy to give anyone a 30-minute presentation, virtual presentation for their organization, for their employees. Some of the organizations that are involved with this are focusing on their staff. Memorial Sloan Kettering is focusing on their staff, and the Joint Commission, which accredits 20,000 organizations, is doing Take Charge 5 steps for their staff. So the quick 5 steps is have your understand and complete your advanced directives. Step number 2 is get your medical records and your medication lists in order. Number 3 is prepare your lists and your symptoms when you go to the doctor. Number 4 is ask caregivers to wash their hands to avoid infections. And number 5 is be an advocate and advocate for others. So each month through March, we start in March through August, we focus on 1 step. And those are the steps that we are told constantly by healthcare professionals to do to stay safe. So we're encouraging people to take some responsibility for their own safety as they enter the healthcare system. As Brad said, it's the 3rd leading cause of death in the country, but yet people are not prepared. We have to stop putting the extra burden on the healthcare providers to get it right 100% of the time when patients are not prepared to go into the hospital or the medical system.
Where do people send donations to? How do they get you the money?
Well, they can go on our website, Pulse Center for Patient Safety.org, and under the donation page. So thank you for offering that.
And how about you, Brad?
Well, our website, gnanow.org, also has a donation page. But if it's over 10,000, I would just request that somebody give me a call at 312-345-0400, because I just really want to personally thank, the moderate to significant donors out there.
Well, if we find someone to give you $10,000, we will say thank you to them as well.
We'll say thank you for 100.
I was just going to say, I think he's taking his checkbook out now.
Oh, I left it in the car. I'll have to go and get it.
Listen, we both know both the organizations are great organizations. But, Eileen, I want to ask you a couple other things. We talked about training before, and Brad said you are the most amazing trainer out there. Tell us about the programs that, you offer and how people can actually take them.
And Brad, do you do the same programs also as Eileen?
No, he said no.
Oh,
we
no.
partner. Okay. Well, the idea is 25 years ago when I started Pulse, I had this crazy fantasy of having a world of patient advocates out there, and we would train them to have people helping people. We call this people helping people. So family members and friends who help their loved one until the loved one dies, and now they have all these skills. What do they do with this? So we did what was called family-centered patient advocacy. It was an 8-hour class over 2 or 3 evenings or mornings, and we were training. We trained hundreds and hundreds of people if they wanted to be a patient advocate. Here comes Brad saying, I have all these patient advocates that some are trained, some want to be trained, some don't have the skills. And I'm saying, well, we need the people to train. So it was just a real marriage there, because we needed the people and he had the advocates. So ideally, we use our training now. We have something called the Pulse Academy, the Patient Safety Advocate Academy. We have the last couple of years, we've had last year actually on virtual.
So how long does it take for me to become a patient advocate?
Well, again, it depends what you want to do. Remember, you walk into Norman and you're helping him. That's a start. So what did you do? If you ask the questions, did you ask him about notes, what notes to take, or what questions?
He saw me acting whoopee. He ran out of the room.
Well, that's one thing.
I go, can I get what he's got?
Darren took care of Darren. But the idea is that we have now on this all the training, the people and our speakers that we have this academy that people could tune into. Patient safety event, I think it's on patient safety event, and you go on there and it will bring you to all our modules that people could take for training for a very small fee of $20. And if people really can't afford it, they can contact me and I'll help them get on it. But then there's an essay and they can take these trainings and we will support them. Once they take our training, we don't walk away from them. They got me and Brad and all our team behind us because Brad does not work alone. I don't work alone. You know many of the advocates we work with.
So if I was interested in doing a certain type of advocacy, you have all these different modules, training in different areas, right?
Many areas.
Right. So if I wanted to be like you, a bedside advocate, you have training for bedside advocacy.
Yes, it's called Yes, it's on their family-centered patient advocacy.
Mm-hmm.
There's a couple that are free on there that they can go on to and learn about. But the family-centered patient advocacy, critical communication is a great one to start off your relationship building with the patient and their family. So there's also quite a few on infection prevention and hand washing and. But they're very sophisticated. They're not, tell somebody to wash their hands. They're 1 hour long, and they're also many of them have continuing education for board certified patient advocates. So they have.
I got a question for you. Twizzlers. I just want to let you know.
Like Twizzlers.
Like she'll tell you. Twizzlers. Costco is getting rid of Twizzlers.
Twizzlers.
It's true story. Yep. Twizzlers. Now, Darren's saying, what the heck you asked about Twizzlers? He knows nothing about Twizzlers. Tell him about and everybody else about what you do with Twizzlers.
Well, I do, and I bet some of these people on the call tonight know this. When we're always telling people, ask your caregiver, ask your clinician to wash their hands, and sometimes it's a little embarrassing when they come in very sophisticated, and you're going to say, "I need you to wash your hands." It's intimidating. You feel vulnerable. It's intimidating. So as an advocate, I carry Twizzlers, individually wrapped. And I said, would you, when they always say, I did already. And I'll say, well, would you do it again for Twizzler? And then everybody smiles. And of course they say, okay. And then ideally you'll see in the pre-surgical area, a bunch of healthcare providers walking around with Twizzlers in their top pocket, and you can one person got it wrong last time I was in the hospital, and he told the other nurses, if you're good, she'll give you a Twizzler. And I said, absolutely not. Wash your hands, you'll get a Twizzler. They all walked around with the.
Mark Berlin just said he's using Twizzlers now too. How many advocates do you have in your group?
Who we work with?
Yeah.
Well, I usually take the calls. I start them out, and then I can farm them out to people who are training or who.
How many total do you have?
Oh, I would say 8, maybe 5 to 8 people that I would call on.
How many people across the country are?
Have you trained? How many people
have we trained? Hundreds of people. I don't even know.
Is it 500, 900,
probably maybe
1,000?
300, maybe 300, 400, maybe 300 or 400 people in classroom situations, and then. We're doing this virtually now, which we get about 25 to 30 people on each call twice a month. We're actually 3 programs a month we're doing now. We're actually stopped for the year, except our patient activation through community conversations, our PAC. I think, Norman, you came on one of those that we put scenarios out. And so discussion group about preparing to be patient. When you think about it, how many people in your audience know what it is an appropriate exam for a 4-year-old girl? Or if you have high blood pressure on the right arm, is a doctor supposed to take it again on the left arm? We don't know these things, but we do know when we talk to people what their experiences are. So
when people go into the hospital, they don't know that they even need an advocate. They go in there,
Well, you go to the blood pressure thing, right? So a week ago, I wasn't feeling well. I went to the doctor, and a nurse took my blood pressure. And she didn't say anything to me. And then a physician's assistant came in and goes, your blood pressure is really high. I don't have high blood pressure. She retook it and was fine. So to me, in my head, I'm thinking that nurse made a mistake. She didn't do it right because the readings came back, wrong, because within 5 minutes, the physician.
You know, there's also another thing, and Eileen and Brad, maybe you can attest to this. Hospitals now are using these modern,
Everything's
meters.
electronic, right?
Gives a total different reading than what the old school wrap around your arm, squeeze, totally different. The electrical ones don't work anywhere near. Now, what did they use when you went into the
They used that
hospital?
one of those electrical ones.
Yeah.
Put it
They
on.
wash it. Watch when they take they
No, they
take
had no
the
Twizzlers,
oximeter off-
they had
I,
nothing.
had no, I didn't have a Twizzler on me.
watch when they take the oximeter off your finger where they put it. They put it right in your pocket, ready for the next person. They don't wash those things either.
Who's thinking of this?
Need an advocate.
Yeah,
Big one, I think.
I mean, you have to understand. I mean, we're not just like trying to get people to wash their hands just for the sake of washing hands. I mean, there's a reason for it. We talked about, you know, the medical error being the third leading cause of death, but you know, within medical error, the real causes are like these hospital acquired infections that are so easy to prevent, and some of them, you know, can turn a basic visit into an emergency room or a quick outpatient surgery into a 4-month hospital stay, because these are super bugs that are immune to the antibiotics. So it's not washing hands for the sake of washing hands. It's there to prevent something bad from happening.
Staph infections, any kind of infection.
And it comes down to people just becoming lazy, right? And us reminding them not to be lazy.
Well, I don't want to call people lazy. I want to say that they forget, and you know, and keep in mind the way I like to think of it is if you run in front of a car, you're walking across the street, and I hit you with my car, I am responsible. But you have some responsibility to look both ways and make sure you don't get hit by a car. And in our society, the healthcare system is not helping the patient and family become educated to look both ways. We just going in blindly, letting them take care of us, and expecting them to get it right 100% of the time. Well, if they forget to wash their hands and they're not washing their hands, I was recently in a doctor's office and I was really annoyed when she didn't wash her hands, because it was the second doctor's office I was in that day with a patient, and said, you know, just wash your hands. And she, you know what she said to me? Do you want me to change my gloves too? I said, yes, I do. And she did.
They gotta learn not to mess with you.
Well, here's the thing, too, and it comes down to economics a lot of times, too, because they're told, hey, you know what? You can't change your gloves every time because it's just too much.
But you gotta change your gloves.
Yes, they can. That's the rule.
I get it's the rule, right? But when they're getting orders from their bosses to not change their gloves if they don't have to, right? And they may word it so it sounds like it's appropriate, right? Because you had to ask her, she had to ask you, do you want me to change your gloves? That should have never popped in her head. She should have just changed her gloves, right? But there's a cost factor in here where people, like, exactly what you just said with the thing they put on the end of the finger. Well, they should take an alcohol swab and clean that.
I do.
Well, I'm saying you do, but I don't know any better. And probably somebody told them, don't clean it every time because it really doesn't matter.
Well,
because it costs money to have an alcohol swab.
And you guys are helping us educate people. So if everybody on this call starts doing it, maybe for our next generation, it will be done. They'll be so annoyed and they'll just start doing the right thing because we're educating people. We have no other venue to educate people except people like you two who are helping us get the word out. So thank you again.
You're welcome.
Okay, go ahead.
Thank you.
I did say that. I'm not going to kiss up to you, but thank you.
He's always looking for somebody to kiss up to.
Oh, last night, Sangeeta did a
big
wonderful job.
I'm going to call her.
I watched the show.
You have to watch last night's show. Sangeeta was great, as always.
She was great.
As always on that.
You know, she's opening a new office.
No, I didn't know that. I'm going to have
Babylon, next month.
Wait. That's Sangeeta's show. That's not.
Yeah, but I'm just saying she's a friend. So I'm not even know.
You don't want to waste stress.
And you would never guess who she thanked for doing that. But you have to watch the show to find out.
You'll never guess. He just, again.
I didn't say anything.
Anyway, so Eileen, do you have anything coming up? Do you have any seminars coming up? Do you have any?
Well, we're always looking for volunteers to help us plan our events and plan our programs. We do have in March, we're planning a conference, so that's exciting. take charge. We're always working on that. And then our patient activation is the first Wednesday of the month at 7:30 p.m. Eastern time, where we all get together and talk about experiences, and we tell stories about entering the healthcare system. So we have a regular steady program coming up, and Brad is involved with everything we do now, his organization and his advocates. So we have access to this amazing whirlwind of information now.
Brad, I'm looking at you, and I'm looking on the wall, and I'm seeing all those plaques that you have up. You are an amazing, amazing man. Can you tell us what all those plaques happen to be? Are they degrees? Are they thank yous? What is it? You know, what exactly is it?
They're bar admissions, Supreme Court, Illinois Supreme Court, federal court.
It's all legal stuff.
God bless you.
Legal stuff. You could do it at Kinko's. It's
Right.
you know, nobody knows.
So Brad, because we're coming down to the end of the hour already, tell us about the other organizations that you're involved with.
Well, I wanted to add that, you know, there is another conference that's coming up in about a week, actually. It's an online conference put on by another nonprofit that we all partner with, and that, you know, we're all trying to do this together, called Health Advocate X. And if anybody just wanted to go to Health Advocate X, Google it, you'll find out about the conference. But it's a really good introduction to the field, and it's right around the corner. So if anybody here, you know, wants to learn a little bit more about, you know, how this field is expanding, who the players are, who to network with, and, you know, learn something of substance in the process, that's a great place to start. You know, I'm a big sponsor, a big promoter of that organization as well. And, you know, I would say that's about it for right now.
Okay. So one more time, Brad, how can people get a hold of you?
I think the best way is to go to gnanow.org or, you know, email me at lbradley@gnanow.org. But, you know, with the internet, there's so many ways to get a hold of me. And if somebody really wants to, I know they're gonna. So any of those ways. L. Bradley Schwartz. You know,
They can get in touch with you directly with the $10,000.
What? Say again?
They can get in touch with you directly with the 10,000.
Well, I thought we were going to talk about what we were going to do with that money when this thing's over.
That's it. That's
Okay.
it. Yeah, Norm will give you a call right afterwards.
Okay. Yeah.
And Eileen, what up with you?
Pulse Center for Patient Safety, and please check us out, LinkedIn, Twitter, Facebook. We're always on Facebook also, so please check us out.
Okay.
All right, excellent.
Will do.
We want to thank you guys for being on the show. As always, great guests. You know,
Thank
Eileen,
you.
You know, you knocked it out of the park as you always do. Brad, thank you for being here.
Wonderful
Brian,
job.
stick
Wonderful.
around. We're going to close up the
Stay
show.
in the green room.
Again,
I
thank
want
you.
to tell everybody about next week's guest.
That's it.
All right.
Thanks, guys.
Thank you, guys. Thanks for everybody.
Again, always, they knock it out of the
Yeah,
park.
they do. Eileen's
knocked it out of the park.
fantastic. Bradley was great. You know,
Don't mess with Eileen.
No, you don't
Just
mess
don't-
with Eileen. You know,
don't.
you know.
You know,
No.
no
We-
arguments,
we
no
know-
conversation.
we know
Just
that.
yes, sir,
We know
Yes,
that from day
and-
one.
and take a Twizzler and walk away.
Yes, we know you're still there, Eileen.
Yes. Yeah.
So yeah, no, we don't mess around. No, Eileen's very honest and open with us about what we do, how we do it.
Yeah, especially like about brain surgery.
Yeah,
You know, that's going to go down in history. We're not telling anybody what that means.
What that means.
Eileen knows what it means, and that's it.
There we go. Anyway,
Habitat for Humanity
yeah, Habitat. Is that next week
next week.
already?
Habitat
Wow.
for Humanity.
So we're gonna have Habitat for Humanity back on. You know, we've had them on before.
This is
so-
a new gentleman who's the director.
Yeah, so it changes
His
up.
name is
but
Lee, and he will be here.
another great
next week.
organization.
Yep.
So
Things are going
everybody,
awful lot.
be safe. If you're in the New York metro area, you know, just this weather is not going to clear until tomorrow afternoon sometime. Maybe if we're lucky. So be safe. If you don't have to go out and drive, don't drive.
Have a great weekend.
Have a great weekend. We will see you right here next
Tuesday,
Tuesday night at 7
the
p.m.
2nd. Good night, everybody. Have
Good
a
night,
nice one.
everybody.